This is Steve Zeltzer with WorkWeek, and I'm talking with Erek Slater. Erek is a driver in CTA Transit, and he's a member of ATU 241 in Chicago, and he's a rank-and-file member. He's an activist, and he's on the executive board. So welcome to WorkWeek.
Thank you, Steve.
So, Erek, why don't you talk about the conditions of transit workers? We've discussed here in San Francisco about transit workers who are getting coronavirus, the lack of protection. Transit workers are afraid they're going to become infected. They are becoming infected. What are your concerns as a transit worker, and what should the company do, CTA, to defend transit workers to make sure that they have a proper health and safety?
Thanks, Steve. I just want to make it clear. I speak for myself. I am an executive board member elected by my coworkers and a shop steward for 3 terms for the Amalgamated Transit Union, Local 241, and I'm also a Chicago Transit Authority bus operator for 14 years now. But I don't speak for any of those organizations. I speak for myself. In terms of what's going on, things are moving pretty quickly. We just had a pretty good scare with a report by the Wall Street Journal put out yesterday that 9 transit workers died last week in New York. We also had a shop steward like myself who died. He's only 41 years old in Washington State, who was an Amalgamated Transit Union bus operator, shop steward. So that's brought it home to a lot of my coworkers. So what's been going on? So for about 3 weeks, myself and a handful of other workers have been looking around the world and watching what's happening in China and in Korea, and then in Europe, especially with Italy and Spain, and now we're seeing it in New York State. And we're saying, well, what measures should we be taking? What are being taken, and what should be taken? So, broadly speaking, the Chicago Transit Authority and PACE suburban buses have been taking measures, in my view, are insufficient, and very, very greatly so. And I and others are concerned that these insufficient and untimely measures may have and may continue to lead to greater sickness and greater death as the hospital systems are pushed to the brink and over. So some of the things that we've been calling for from the very beginning is just simple things like hand sanitizers, because we can't go to the bathroom to wash our hands as bus operators and rail operators. Things like masks, especially N95 masks, and properly fitted, properly trained how to do it by a medical professional. We have not gotten that even to this point, although my union is just trying to get 50,000 masks as we speak, and hopefully get them out. The other things we've been calling for are for more overtime to be given and to more workers to be hired to clean the buses and trains, the terminals, the bus garages, and to make sure that they're deep cleaned and freed from the virus with the proper equipment, with the proper antiviral agents, but also the workers are properly safeguarded with protective equipment, personal protective equipment. And that is not going on. What is going on, as of just a week ago, is they're finally releasing workers to be able to do overtime, straight overtime, not time and a half or double time among the current workers to do some cleaning. And as far as I understand, even the deep cleaning schedule hasn't even changed. It's perhaps 14 one bus is deep cleaned every 14 days when many medical experts are calling for once a day. And so they would really have to massively increase the amount of workers doing that work. And I think there's workers who want to do it, willing to do it, but they should be protected and they should be compensated appropriately for the risk they're taking to themselves and their family. So other concerns that we're facing is we're trying to get off the bus and the train and other maintenance and clerical work when we have an underlying condition, when perhaps even just over 60 years old, if you got heart or lung disease, or if you have a family member in your home who's at risk, because if you get it on the buses and trains or at maintenance garages, you then bring it back to your family and your community. So we're very concerned. the other thing is the passengers getting on the buses maybe spreading into themselves, buses and trains maybe spreading to other passengers. The bus itself is a vector. It's not just the social distancing measures that need to happen with, for instance, blocking off the front of the bus, perhaps, for everyone except for ADA passengers who need the wheelchair lift or people who need the bus to kneel. But it's also the surfaces themselves. Apparently, this virus can stay alive, if it is alive, for at least several days, especially on things like metallic surfaces, like a bus stanchion or metal bar. And so this is very, very important, not just for our safety as transit workers, but to actually, as people are saying, flatten the curve so that the hospitals are not overtaxed. And the CTA is not really taking these measures seriously. And we already know of at least several cases confirmed of transit workers, and we strongly suspect, that there are many, many, many more transit workers who are currently infected and are currently out there on the buses and trains giving it to other passengers and other transit workers. We are not being tested, and that's really egregious. It's extremely dangerous, and it may be causing a great deal of harm. We're not getting the proper PPE equipment. So workers are discussing stopping the transit system, and we understand that's a serious task, a serious thing to do, because we know that that'll also lead to people getting harmed, because the custodial workers, the maintenance workers, the nurses that go to the hospitals can take our buses and trains. And that may mean someone in ICU doesn't have a nurse, or that nurse is working for 5 or 10 more patients, and that may kill people. But we're really concerned that if the transit agencies continue to do this halfway measures, then many, many more people may die. So that's where we're at, and we're trying to get our unions also to take this, more urgently. Now, a lot of our unions have called us ending of mass membership meetings for understandable reasons, because we can't physically all get into a meeting. But workers are calling for, over the phone or over the internet meetings in which rank-and-file workers can put forth their perspective on what needs to be done, and we can continue operating through our internal democracy and our unions to take action. And we have a particularly important role as unionized workers, especially frontline workers like transit workers and public transit workers, to safeguard the working class populations, because really the governments are not acting, or they're not acting quickly enough or appropriately enough given the circumstances. So it's on workers, frontline workers, to actually take these measures in our own hands.
And we're speaking with Erek Slater. He's a driver with the MTA in Chicago Transit Authority, actually. And he is discussing the health and safety concerns that he and other drivers have, and the necessity of keeping the buses going. Now, Erek, this is a national, international problem. If you're deemed essential worker, which is what you are, as is UPS and other workers, if you and other workers get sick in these essential services who are delivering supplies, that would mean people will not be able to get to where they're going to work, get to the hospital, or even have enough to eat, because food is now being delivered. Why isn't the government taking the responsibility? It seems that Cuomo, the governors, the politicians, none of them are talking about the need, the critical need to protect these essential workers, including bus drivers in Chicago.
And New York. I'm in communication with some rank-and-file workers in New York, and they've been the same kind of fight. And they're maybe a week or two ahead of us, but still they're not taking the necessary measures. Well, to answer your question, in my view, it's because the government is not our government. It's a government that's really used to doing what we see on the shop floor every day, which is attack our working conditions, our living conditions, and try to squeeze us to work harder and faster for less money. And that goes all the way up to the top. And it's not a government set up for the needs of working people, and certainly not controlled by working people. And so we're seeing this. This virus is showcasing the form of government that we have on a state and national, international level, it's not set up for human needs. It's not set up for working people to make collective decisions and to do it quickly to be able to handle something like this. We're seeing it also in every level. In our unions, we're really not set up to take quick actions like this from the rank and file perspective. We have some people who are maybe off the buses or off the trains that are saying, well, it's okay. We're just going to do these things. It's not really serious. And, it's only for old people or whatever they're saying. And the urgency from the rank and file workers has not structurally been able to move quickly. And it may happen in the next 24 hours in Chicago. We'll see. But that's a real problem with the way society is organized. And I'm hopeful that not only we're going to be able to save some lives, but we're going to hopefully be able to take back some of this control so something like this never happens again.
And again, we're speaking with Erek Slater, a driver, Chicago Transit Authority, also an activist, and also an elected member of the executive board of ATU 241. Now, excuse me here. So, Erek, we're looking now at 30 to 40 million workers being unemployed because of this pandemic and the inability to have controlled it or stopped it. There's chaos. I know yesterday, and we saw a picture of a UPS delivery where the woman there was trying to put up some supplies on the door for her UPS driver. When we talk about 30, 40 million, obviously never in our lives have we seen that kind of mass unemployment in the United States. Do you think this raises the issue of restructuring our society so working people take control of it? I mean, you have a situation where these billionaires in Chicago and San Francisco around the world are really running the world, and they are profiteering. Prices of mass and others are skyrocketing. There's even no control on protection, personal protective equipment. Is this a system crisis, not just a pandemic, but a system crisis of how the system is organized?
Yeah, it would have been a relatively minor matter if human society was organized on the needs of human needs and the earth and life on earth. If that was the priority of the socioeconomic system on a world scale, then this would be a relatively minor thing. Viruses have been around perhaps more than life. We've been co-evolving with them for quite a long time. The problems I think we're seeing very clearly is that the health systems have been cut. They've been run on a for-profit basis. Even the social services, I see it as a work in the United States, but this is going on around the world. These cuts, these austerity against things that are generally human needs, and never mind preparing for when the bottom is not necessary, but actually quite a bit more of health services are necessary in something like a pandemic. And all they want to do is cut the needs of working people. So there's a fundamental reorganization is necessary. I could say, on the shop floor level here, we are demanding that, or some workers are demanding that everyone be sent home who wishes to be home. And people come in on a voluntary basis at double their hourly wage. And the other thing is workers may need to organize the work more. We need to, because we'll have less people, and there's less people taking public transportation. We may need to say, okay, well, one of the routes I drive is the 50 Damon, which goes by three public hospitals. Well, that's clearly going to need to have quite a bit of service, and enough service so that the passengers can be socially distanced, whereas some other routes that might go through, tourist attractions, or et cetera, might not need as many work. So those are decisions that the workers should make, and passengers and working class community organizations should be starting to make as a way of showing another way that we don't need to have these for-profit measures. We don't need to have these these managers over us that have never done our work, that don't face our concerns and really don't know. We're the experts. The frontline workers are the experts and should be making decisions and taking control.
And last question, the question of housing. I mean, well, healthcare, the need for national healthcare to get rid of the for-profit hospitals, but also housing in Chicago, around the country. People are having to pay their bills today. It's April the 1st. Do you think that there should be a moratorium on rent increases, on evictions, and really these companies that are profiteering off of housing have to be challenged so people can survive, people can stay in their homes?
So housing is a big issue for the transit workers, and I'm going to speak from that perspective. We have a huge homeless problem in Chicago. Many are former veterans in the military with all kinds of concerns. And then, of course, we've also had a cut in social services for things like mental health and other social services. But we should all keep in mind that someone who's homeless right now or is forced to be homeless because of an eviction order is now in even greater harm, not just the great cold or extreme temperatures of Chicago, but also because of the virus. And that is not just a horrible humanitarian problem for that individual and their family. It's also a danger to all of us that now that virus is going to be spreading to other people. We get a lot of persons without homes on our trains that sleep, especially the Red Line. We have, a worker had put out a video of it, of just going through the 8 cars or whatever of the train and seeing like 15 people on each car, with a blanket sleeping because they had no other place to go, no place that was temperature controlled. And that itself is extremely dangerous to those people. They're touching the surfaces that, thousands of people touch throughout the day. It's, of course, a danger to the transit workers. Us as bus operators have the same concerns with what they call continuous riders. So one of the demands that groups of transit workers have put out is, and I believe some of this stuff has happened in California, where you guys are from, that there be purchased housing and professional housing, not just places a ditch in the road, to take over things like dormitories for universities and open them up to persons without housing. Open up these hotels. They're having 10 or 15 or 20% occupancy, and they're laying off a lot of workers in the hospital, in the hotel industry. Well, properly safeguard these workers, bring them back to work, give them proper hazard pay, and let persons with homelessness sleep in properly maintained hotels. Those are some things that could be done. I do want to say that whatever happens, we do need testing. We do need proper PPE protective equipment. And then on only those lines, on union-controlled safety precautions at each work location, then we can start talking about reopening businesses. We can start reopening the productive capacity. It really has to be the frontline workers taking control of the situation and making sure it's safe for everybody.
Well, it sounds like maybe a program for a Labor Party or a Workers' Party. I don't see that happening with the Democrats. I know in California, which is a Democratic state, as is Illinois, we have thousands and thousands of hotel rooms, empty hotel rooms, and there seems to be a problem of placing homeless people in these hotel rooms, even though that they're empty. So people are instead dying on the street, and it seems that may be a problem all over the country.
Yeah, well, the real problem is capitalism. I'll go right at it. Capitalism in class-divided society, you could argue more generally, needs homelessness. You can't get somebody to pay for rent if they can go have someplace better, as good or better for free, or very low income. So it's a small group, relatively small percentage of the population that just sits on this rent income. It's not just rent income. It's capitalists of all sorts and super wealthy. It's just not necessary. We don't need to have this threat against all working people that if you don't pay your rent, if you don't work for some boss who treats you like a badge number, if you don't do exactly what they say when they say it under dangerous conditions, then we're going to throw you out. We're going to make you humiliated. We're going to potentially kill you or throw you in jail. This is all what's necessary in order for a small group of people percentage-wise in the human population to have these privileges over the rest of us. And the housing shortage is very clear. We have huge capacity to build far more than we ever could need of the most beautiful, aesthetic housing that's safe. But it's not done because of this artificial scarcity that's forced upon us through the very logic of the economic system. I hope that more people start seeing through it and seeing what the historical context, the worldwide context of this crisis that we're facing directly, and start to see another way forward, that where working people can lead humanity to overcome this economic system on a local, national, and international level, and throw out this need for profit, throw out this need for desperate conditions. It's not necessary. Our world is an Eden, and we should reclaim it.
Okay, well, I want to thank you for joining us. We've been talking with Erek Slater, and he is a driver in the Chicago Transit Authority and is struggling to defend himself and other drivers with protective equipment and also the passengers and the public. So thanks for joining us on WorkWeek.
Thanks, Steve.